In contemporary US practice, octogenarians and nonagenarians undergoing transcatheter mitral valve repair or replacement have similar in-hospital safety outcomes and short-term readmissions compared to their younger counterparts. Therefore, age alone should not be used to preclude transcatheter mitral valve interventions in otherwise appropriate candidates. I'm Mahmoud Ismail. I'm one of the third-year Chief Cardiology Fellows and an Assistant Professor of Medicine here at Mayo Clinic in Rochester, and an incoming Interventional Fellow starting July of 2026. I'm very pleased to share our article entitled In-Hospital Outcomes and Readmissions Following Transcatheter Mitral Valve Interventions in Octogenarians and Nonagenarians, which will appear in an upcoming issue of Mayo Clinic Proceedings in March of 2026. Using the Nationwide Readmissions Database, which is the largest publicly available, fully de-identified readmissions database in the United States, we aim to evaluate the outcomes of transcatheter mitral valve repair and replacement in the very elderly population across the United States. We found that the use of transcatheter mitral valve interventions has increased over the years across all age groups, including octogenarians and nonagenarians. After adjustment for potential confounders, we found that octogenarians and nonagenarians had similar adjusted in-hospital outcomes, including mortality, complications, hospital length of stay, and total costs. In addition, 90-day and 180-day all-cause readmissions were similar between the very elderly population and younger patients. Importantly, heart failure was the most common cause of readmission. However, the adjusted risk was not increased in the very elderly population. At Mayo Clinic, transcatheter mitral valve interventions are guided by a multidisciplinary heart team approach, emphasizing individualized patient selection rather than using age-based cutoffs. Our data supports this philosophy that careful selection and careful assessment of frailty, comorbidities, anatomy, and patient goals rather than using chronological age alone results in favorable outcomes even in the very elderly population. Our results provide reassurance to clinicians that transcatheter mitral valve interventions can be performed safely in carefully selected elderly patients, including nonagenarians. Our data also supports shared decision-making and encourages clinicians to not exclude patients solely based on age alone when considering transcatheter mitral valve interventions. For patients and families, our study offers an important message. Being in your 80s and 90s does not automatically mean worse outcomes following transcatheter mitral valve interventions. When appropriately selected, elderly patients can expect similar in-hospital safety outcomes and short-term readmissions compared to younger patients. Moving forward, future research should focus on long-term outcomes, functional status, and quality of life following transcatheter mitral valve interventions in the very elderly populations. Additionally, integrating frailty metrics and more granular clinical data will help refine risk stratification and further personalized care for the very elderly populations. I would like to encourage you to read our article, which will appear in the upcoming issue of the Mayo Clinic Proceedings in March of 2026. Thank you very much.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com/Mayo Proceedings, or journal updates on Facebook, www.facebook.com/Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.